Hello and welcome to Module 1A, Part 2, where we'll talk about health, stress, and behavioral health. Learning objectives for this pre-work module include exploring the components of behavioral health with a focus on health and wellness, stress in the brain, mental health, and behavioral health. We'll also understand the prevalence of behavioral health challenges in Rhode Island as a way to connect with the work that we're doing in your field. Components of behavioral health. Let's explore what the components entail. First, you may be familiar with the terms both mental and behavioral health. The terms are used interchangeably, however, there are some distinctions. When we look at mental health and what it is, we're really talking specifically at emotional, psychological, and social well-being within an individual that really informs how we think, feel, act, make decisions, and cope with life changes and stress. When a person has stable mental health, they're able to manage day-to-day stress, interactions, and contribute to the community, work productively, and realize their potential. However, when their mental health is challenged, they experience some dysfunction in those areas. When we look on the right side of the screen at what behavioral health is, we start to see a definition for a term that has the potential to be much more holistic and inclusive because it focuses on habits and the impacts of habits on overall mental and physical health. So behavioral health is an opportunity for us to consider the mind, body, and spirit connections and how those three facets of our lives impact us both physically and mentally. And for that reason, we are moving more toward embracing the holism that is associated with behavioral health. When we think about the inclusive term behavioral health, and we recognize the mental and emotional well-being that is involved in how it impacts both choices and actions, which have the ability to impact our wellness, as well as the feelings that can either make us feel elated and successful or give us a sense of dis-ease and impairment of some of our functioning. So when we're looking at behavioral health and certainly the outcome of participating in this certificate program, the idea is that we want to focus on supports and interventions that promote wellness in the communities that we're working with. Oftentimes, there is resilience in individual in their coping and in their history. Communities have tremendous strengths and they can promote some wellness outcomes. And sometimes we're getting involved because of a compromise to behavioral health where there has been that dis-ease in life experience and interactions where we've seen as a result of it functional impairment. And so what we might be doing as a result of taking this training is identifying when people are experiencing difficulty and providing them with the support to intervene in a way that takes this kind of depletion of behavioral health and works collaboratively with them to move up toward wellness. So let's talk a little bit about wellness. Wellness essentially is striving for or being in a place of good physical and mental health. When we think about mental or behavioral health and physical health's link, think about when your mind is clear and you're feeling confident and strong, you tend to be more in control of your physical self. If you're exercising, eating well, that has a reciprocal benefit for your mind and spirit. And so there's a real dynamic symbiosis there in that relationship. And so we know that when we positively or negatively impact our health or our mental health or our physical health, that we have the potential for having a reciprocal impact on the other one. So if I'm feeling very down and low emotionally and my mental health is being affected, maybe I'm more lethargic and I'm not eating healthy and I'm not moving around. And so my mental state has a direct impact on my physical well-being. When we think about wellness, wellness is an interesting term because it's not about opposites. It's not about the opposite or the absence of illness or stress. It's really about having the skills and the resilience to move forward no matter what you're confronting, and to do so in a way that allows you to continue to function and to kind of maintain your full self going forward. Things that counter wellness include things like stress, and stress can be very all-encompassing. On this slide, we see 3 different types of stress, all with the potential to both physically and mentally impact our health. We look at routine stress. These are day-to-day stressors that confront our lives and that we have to navigate. And that can tire us out, wear us down because they go on long term. We see acute stress, which is the result of something happening in the moment, shorter term stresses, such as the birth of a baby, which changes the whole family system, the loss of a job, which has the ability to both socially, emotionally, and economically impact an individual and or family system. And then we see things like traumatic stress, which can have their etiology in our childhoods, where we've experienced a traumatic event, an adverse childhood experience that we bring with us into adulthood. It can be the result of traumatic experiences that have happened to us through adolescence into adulthood. As an adult, having a car accident, a tragic car accident where there's a loss of life or a serious injury, that can create a traumatic stress where when someone's in a car or has to drive, they have difficulty. Unexpected loss of loved ones can be things that contribute to traumatic stress as we get older. Natural disasters. Any type of stress is going to challenge us. In some cases, it can challenge us to step up and build skills to overcome, but then also in some places, it can be that obstacle that we just can't get over or go around, and that we're going to need some support with. And so when we think about questions about stress and whether or not it's a pervasive effect on our whole health, and then what can we do, it really becomes helpful to understand what stress in the brain look like. And so we're going to watch a brief video in the next slide, just to be mindful that it's not just an emotional state that's occurring, but that our brain is engaged. All the hormonal systems in our body are engaged when we're elated or when we're stressed. And so we want to understand a little bit about what that connection is so that we can be more responsive.
Are you sleeping restlessly, feeling irritable or moody, forgetting little things, and feeling overwhelmed and isolated? Don't worry, we've all been there. You're probably just stressed out. Stress isn't always a bad thing. It can be handy for a burst of extra energy and focus, like when you're playing a competitive sport or have to speak in public. But when it's continuous, the kind most of us face day in and day out, it actually begins to change your brain. Chronic stress, like being overworked or having arguments at home, can affect brain size, its structure, and how it functions, right down to the level of your genes. Stress begins with something called the hypothalamus-pituitary-adrenal axis, a series of interactions between endocrine glands in the brain and on the kidney, which controls your body's reaction to stress. When your brain detects a stressful situation, your HPA axis is instantly activated and releases a hormone called cortisol, which primes your body for instant action. But high levels of cortisol over long periods of time wreak havoc on your brain. For example, chronic stress increases the activity level and number of neural connections in the amygdala, your brain's fear center. And as levels of cortisol rise, electric signals in your hippocampus, the part of the brain associated with learning, memories, and stress control, deteriorate. The hippocampus also inhibits the activity of the HPA axis, so when it weakens, so does your ability to control your stress. That's not all though. Cortisol can literally cause your brain to shrink in size. Too much of it results in the loss of synaptic connections between neurons and the shrinking of your prefrontal cortex, the part of your brain that regulates behaviors like concentration, decision-making, judgment, and social interaction. It also leads to fewer new brain cells being made in the hippocampus. This means chronic stress might make it harder for you to learn and remember things, and also set the stage for more serious mental problems like depression and eventually Alzheimer's disease. The effects of stress may filter right down to your brain's DNA. An experiment showed that the amount of nurturing a mother rat provides its newborn baby plays a part in determining how that baby responds to stress later in life. The pups of nurturing moms turned out less sensitive to stress because their brains developed more cortisol receptors, which stick to cortisol and dampen the stress response. The pups of negligent moms had the opposite outcome, and so became more sensitive to stress throughout life. These are considered epigenetic changes, meaning that they affect which genes are expressed without directly changing the genetic code. And these changes can be reversed if the moms are swapped. But there's a surprising result. The epigenetic changes caused by one single mother rat were passed down to many generations of rats after her. In other words, the results of these actions were inheritable. It's not all bad news though. There are many ways to reverse what cortisol does to your stressed brain. The most powerful weapons are exercise and meditation, which involves breathing deeply and being aware and focused on your surroundings. Both of these activities decrease your stress and increase the size of the hippocampus, thereby improving your memory. So don't feel defeated by the pressures of daily life. Get in control of your stress before it takes control of you.
So that video really is an opportunity for us to think about the mind-body connection when we encounter difficult situations and challenges, all the way up to significant traumas. So when we're working with clients and we're working with someone who's going through a difficult situation, it's really important for us to pause and to think a little bit about where they might be coming from and what might be going on for them, and not to just fixate on the manifestation of the behavior or acting out that we're seeing, but recognizing that their experience is integrated throughout their entire body, and you know, we're likely to see the side effects of that. So when we move from wellness and we encounter stress that we're not able to cope with, and we experience a decrease in functioning in different areas of our life, all the way up to some of those brain changes that we just saw in the video, we start to compromise our mental health as well as our physical health. And so this next video, we're gonna have the opportunity to consider mental health as a continuum from being mentally healthy to going kind of to a place where our health is compromised.
have mental health, it is just as important as physical health. It is not only about mental illness or mental disorders. This is just one part of a bigger picture. It's best to think about mental health as being on a continuum, rather than people being either mentally ill or mentally well. We are all on the continuum, and we move up and down according to factors such as our genetic makeup and upbringing, our life circumstances, and the stresses we are under. At one end of the continuum, we have mental disorders, like depression or anxiety. And at the other end, we have states of positive mental health, when we're thriving, content, and fulfilled. The aim of mental health interventions is to move people up the continuum so that they're able to reach their full potential and live satisfying lives. The World Health Organization describes mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Being mentally healthy means being resilient and able to cope with difficult times, feeling in control, being confident, feeling good about yourself, managing and expressing your emotions, building and maintaining good relationships. We all experience periods when we feel stressed, worried, anxious, sad, afraid, or angry. These are all normal emotions. However, when these emotions become severe enough that it interferes with a person's ability to function daily, and these feelings become persistent over time, then it can develop into a mental health problem. There are many different types of mental disorders. When left untreated, mental disorders can be chronic and long-lasting, and are associated with increased disability. They significantly have an impact on daily functioning and frequently interfere with family, social, and work responsibilities. Fortunately, there are effective treatments and evidence-based interventions available that aim to help individuals understand and cope with symptoms of mental illness. However, very few people with mental disorders access existing treatment services. This may be due to barriers such as the stigma attached to seeking help, the lack of understanding of mental health problems, uncertainty of how to get help, or the fear of disclosing mental health problems. Research shows that stigma remains one of the biggest factors preventing people from seeking help early for their mental health problems and getting the appropriate support they need. It is important to acknowledge that we all have mental health and have a personal responsibility to learn how we can improve and maintain our well-being in order to lead meaningful and satisfying lives. Want to learn how you can do this? Great news! Why not join one of our communities and keep exploring Maudsley Learning online?
Hopefully this video offered an opportunity for you to consider how taking this course and getting your certificate in behavioral health represents an opportunity for what you can bring into your organization as a resource, not just for the agency, but also for the people that you're working with. And so throughout the 30 hours of training that you'll be participating in, you're going to learn all about behavioral health from different perspectives. We're going to explore kind of the prevalent disorders. We're going to be looking at issues of substance use and recovery. We will be looking at communication and professional behaviors, as well as cultural context and communication, all so that we can learn to be more attentive. We'll have the opportunity to explore the trans-theoretical model through the stages of change and motivational interviewing techniques that can really help us be more attentive and engage in active listening, and to use techniques to engage people in conversations that can really help them become a partner with us and kind of in working toward their own health. And so this initial module just really kind of helps to set the tone for all of the richness that's awaiting for you in this curriculum. When we think about behavioral health disorders, we're kind of moving down that continuum that we just saw in the video, and we're looking at where there's an impairment, but we're looking at mental health diagnoses, and we saw some of the labels that people can be diagnosed with in the video: anxiety, depression, schizophrenia, substance use disorder. And one of the interesting things that we'll spend some time on in this curriculum is the idea of co-occurring disorders. And that's when we have a mental health diagnosis paired with another diagnosis, and it can be mental health and substance use. It can be a mental health and a physical comorbidity that is there, and it gives us an opportunity again to recognize and to be responsive to that mind-body connection that happens. When we find someone who is affected with a behavioral health challenge, we know that they're very common, and fortunately they're very treatable. However, they can be serious, and it's incredibly important that we take serious our role in being able to start to recognize when people are in distress, and how to share information with them and to assess their readiness to move along that continuum, to kind of embrace changes to move to a healthier place for themselves, so that we can be an agent of change with them and connect them to resources, and even talk to them about different opportunities for referrals for treatment, as well as their readiness to make changes. Let's spend just a little bit of time as we kind of come to the end of this first module, and look at why this information matters. Certainly, your organization has enough recognition of the importance of this topic to have sent you to this training. You value the importance of this training, or you would not be here. So this topic obviously holds meaning for you. But let's just take a second and look at it from a state perspective. Later in the curriculum, we'll be able to look at some of the national trends. I just want to impress upon you the importance of being prepared to respond for behavioral health challenges, because they are a significant factor here in Rhode Island. Some of the things we know about behavioral health disorders: they are a common cause of disability in the United States. And in fact, about a third of adults in any given year may encounter difficulty due to behavioral health that can affect them in their job, schooling, family life. We know that behavioral health disorders can impact daily functioning. It can affect people's relationships, employment, education, the ability to care for themselves, as well as family members, including dependent children or aging family members. So the reciprocal impacts, it's more than just that individual. And so when we're thinking about working with folks affected with behavioral health challenges, we need to be system oriented, and we need to consider social determinants of health and the strengths that they have that can support them, as well as the challenges that they might be encountering. We need to consider things like race and ethnicity, systemic racism, microaggressions, things that have contributed to the difficult position that a person might find them in. And we also need to think about special populations where people may be struggling with addiction, be affected by HIV, be having difficulty with poverty and homelessness. All of these different variables really impact a person's response to behavioral health challenges and their ability to consider accessing help. We know that if people's basic needs aren't met, it's very difficult for them to avail themselves to some kind of therapeutic intervention. So we need to meet people where they are and let our support for them start with exactly what it is that they need. Sadly, we are among the states with the highest rates of substance use disorders in the country, and our rates of people dying through the opioid overdose is extremely high in comparison to the national average. We are second in the country for illicit drug or alcohol dependency abuse, and we can see this number at a relatively high level, both where we have adolescents and adults. And we are also ninth with people misusing prescriptions for self-medication. When we think again about that important mind-body connection, the Hospital Association of Rhode Island's Community Health Needs Assessment did a really wonderful job making connections between the reciprocal impacts between behavioral health and community health issues. And what they discovered was the presence of significant mental health and substance use challenges, and kind of a co-occurrence with issues related to diabetes, people struggling with issues of weight and obesity, people not being able to access necessary care, coronary disease, cancer, specifically breast and lung cancer, and asthma. And so this list here, we have the behavioral health challenges at the top. It's a reminder to us that they don't exist in a vacuum, that they exist part and parcel of some of the other life experiences and physical challenges that people have. And so we're never encountering a person on one plane. We're never just looking at a behavioral health issue or a medical issue. We know that medical diagnoses can contribute to feelings of depression and a need for support. And so it's really critical that we go into this training and then the work that we're doing mindful of the fact that we're always needing to respond holistically. When we think about why it's important, I thought it might be helpful for you to see a comparison on just some of the behavioral health indicators where we compare the state to the nation. These numbers are a little bit older, but they haven't decreased substantially enough to not make them relevant. But we see here that with young adults 18 to 24, that the prevalence of binge drinking and dependence on alcohol and or drugs surpasses that of the national rate. And the same is true for diagnoses of depression, serious mental illness, and substance use for adults ages 25 to 64, where our numbers are slightly higher than that of the national average. And so that helps us realize that for Rhode Island, being proactive and having the skill set to be able to recognize when someone may be having a behavioral health challenge, or definitely is having a behavioral health challenge, knowing what the symptoms are that we're seeing and having the baseline skills to be able to engage them, support them through referrals is critical. It's critical for us across community health centers. It's critical for us in schools. There's not one place, one service industry that being aware of behavioral health challenges is not a value add and a necessity. I mentioned this earlier in terms of the occurrence of opioid overdoses in Rhode Island, and we can see here, as compared to the United States, that Rhode Island is almost slightly under double the national average, which lets us know that this is an area that we're going to be encountering if you're not already, and I suspect many of you are. When we think about really wanting to be mindful that we're never dealing with an issue in isolation, this NAMI fact sheet, I think, is really helpful because it reminds us that we always have to start with the person. That's the point of impact. That's the point of motivation that we're seeking to be a partner in sparking, so that people may pursue behavior change and move toward a healthier self. But we also want to be mindful of the broader implications of what happens when somebody experiences a challenge in their life, that it doesn't stop with them. It has a ripple effect. And we know that people with serious mental illness have an increase for chronic disease like diabetes and cancer. If you think back to the video that we just saw, we saw what happens with the kind of ongoing presence of cortisol when stress is an ongoing issue and how that affects the physical body. We know that caring for our aging family members or adults who have emotional and or behavioral health issues is something that is likely to exist in our lives and the lives of the clients that we're working with. The fact that social determinants of health is a variable that plays a part in people's ability to access quality care, the ability to be evaluated in a timely manner so that people can receive support as early as possible, and then just the consequences of issues of poverty and homelessness, issues with literacy, not living in safe communities, that also has the impact of not just being outside of the individual, but also affecting how they're feeling inside and how they see their connection to the larger world. And so just some of these different variables for us to be thinking about the multiple levels, that ecosystem approach, about the person, the family, the community, and the world. And certainly you're taking this certificate program at a really unique time as we're struggling with the pandemic, as we have encountered marches for social justice with people banding together on issues of social justice and equity. And we have an opportunity right now to really stop and pause and see how these are impacting our communities and see what we can do to be agents of change in responding to these. Some more statistics that probably give us pause and may leave you wondering when you're going to see maybe some more optimistic information in these slides. As we come to the end of this module, I hope you're excited about the kind of richness that is entailed in behavioral health and the different components that you'll be integrating in your work with people and learning more about. The fact that behavioral health challenges don't exist in isolation, but in fact are parts of both physical and mental and spiritual experiences. They're connected to the society around us, people's family histories, their cultural histories, social histories, political, economic histories. And so it's a very complex place for practice. And you're going to be getting some really important information that is going to really provide you with skills and knowledge to be able to go forth in your organization and to really help be a support around issues of behavioral health and promoting the wellness of those that you're working with. Thanks for listening.